She's a 10-year-old female spayed dog, and she's here for a dental cleaning today. We start by doing a complete physical exam before we put any patient under anesthesia. And one of the first things we do is get their weight. Hold up. Put your bone on there. Everybody likes to cheat. Sit. Sit. 41, 8. And we record all of the important vital information on her exam. So after we give her weight, then I'm going to check her out. Sit. Check her teeth and her gum color. And as you can see on her examination, she has a lot of tartar, especially on her back molars. And so we check her eyes. She's getting a little bit older. I noticed some cloudiness in her eyes. Check her ears. And we feel all her lymph nodes and her body for any masses or anything unusual. Turn around and let Melissa hold her head. Feel her belly. Feel her peripheral pulses and the rest of her lymph nodes and her joints of her back leg as well. And listen to her heart and her lungs. She's healthy as we expected. So now we're going to calculate her medications for her anesthesia and draw her blood. We do take their temperature. Because she is an older pet, we are going to do her blood work before we put her under anesthesia, just to make sure that her kidney and liver functions are working perfectly and can handle the strain of going under anesthesia and recovery. All right, come here. Sit. Sit. What do you want me to do? Give her 2 shots to start off with. One is an anti-inflammatory pain reliever that she'll get some to go home with if we decide she has any continuing pain in her mouth. And the second shot she's going to get in the muscle is a sedation and pain relief to help relieve some of her anxiety and prepare her to transition to anesthesia smoothly. Now we're going to let her rest in the kennel for 10 to 15 minutes and let the medication start working.
So this is Melissa, our veterinary technician. She is getting ready to run Sage's blood work, her pre-surgery blood work, to make sure all of her organs are working properly. and she's gonna, the blood work's starting and take a few minutes and it will be done.
You can see that Sage's sedation worked quite well, and she's looking a little loopy. So now we're gonna get her out of the kennel and place her. So here we're all set up to do Sage's dental. You can see we have our scaler and polisher machine right here that Melissa will be using to clean her teeth. And she'll be supported on a warm water bath and blanket. And then we have the full anesthesia monitoring, which is going to monitor her heart and her breathing and her oxygen and her blood pressure if needed. Then we will record all of those details on this sheet so that we can keep track of how she's doing while she's under anesthesia. Be back in a few. So Melissa's going to start the dental procedure by cracking the big tartar off of the teeth. And so she'll go through and do that on every tooth, and then she's going to come back through with the scaler and scale the teeth and scale subgingivally to get all of that bacteria and tartar that's building up under the gum line. You can see the orange tube going down her throat and the clamp on her tongue are both ways that we're using to monitor her under anesthesia while we're cleaning her teeth. Now that Melissa has finished cracking the tartar off of the teeth, she's going to start scaling each tooth. She's going to scale the entire surface of each tooth, and like I said before, subgingivally to remove any of the tartar and bacteria starting to build up under the gum line, which is where all this tartar starts. So she's going to go through the full mouth, doing all of the teeth, front and back. Even if they don't look like they have a bunch of tartar on the tooth itself, she's going to go under the gum line to hopefully prevent and slow the progression of the tartar as it continues. While she's doing that, I'm constantly monitoring the pet under anesthesia, monitoring our machine, visually observing the pet to make sure they're breathing normally. If need to, I'll use my stethoscope and listen to her heart every now and then. The great thing about our monitoring is it monitors their heart, their oxygen status, their body temperature, and blood pressure if needed. So it's been about 20 minutes now that Melissa has finished scaling all of the teeth and polished the other side of the mouth. And now she's gonna, you're gonna see her polishing the right side of the mouth. We put on a pumice paste on there, and then she'll use the polisher just like as if you had gone to the dentist, and polish all the teeth to make sure we get any last remaining bits of tartar off of there so that she starts out fresh tomorrow. Now, for those of you dental enthusiasts, you'll notice that Melissa's not wearing her mask and eye protection. That's of her own choice. And Melissa did go to, she was trained on the job to do dentistry, and then she's been to a class at the Aquindo Veterinary Teaching Facility outside of Las Vegas, where they got hands-on training in pet dentistry as well. So when they're under anesthesia, we also like to check their ears to finish part of our examination, so that we can get a good look down in there without them struggling. Her ears look really good. That ear looks good. Okay, let's do her other side. Just good. They look good. Now we'll trim her nails while she's waking up here. We've turned off her anesthesia, so right now she's just getting oxygen to help fully wake up from her procedure, and we're going to trim her nails too while we got her quiet and calm. Oftentimes with little small breed dogs, we also do their anal glands while they're asleep. Nails aren't as long as I thought they'd be.